So this is going to be your the study stack. This is those nursing flashcards that I was talking to you guys about. They're already created. Okay, so you don't have to spend time creating these flashcards. They're already done for you. And as you can see, it has some NCLEX exam questions in there for pharmacology. So if one of your topics is pharmacology on your study tracker that we talked about, and one of the things that you want to do is create flashcards as a way of doing your space repetition, you can come right on here to Study Stack and hit those NCLEX exam questions, and they're going to bring you up flashcards. And as you can see, the dates that the information is posted, June the 22nd, 2024. So this is real-time information. You're not getting anything that's outdated. And this is a great, great way to study and help you with retaining information. So let's see if I can click on one of these for you guys. So as you can see, it has on here normal sodium. So it's asking these values can change based on the hospital or institution that you're in, but for the most part, for your studying, they're going to be pretty much the same. So normal sodium is 135 to 145. That's what I think the answer is. I'm going to click to flip, and it's going to let me know that my answer is correct, 135 to 145. I can now drag that card over to no, and it's going to bring up another one. What's normal potassium? So normal potassium is 3.5 to 5. That's what I think it is. I'm going to click to flip to see if that is correct, and then I'm going to drop it down to no. What's a normal BUN? I think it's 0.1 to 0.25. I'm not sure. I'm going to click to flip to see if my answer is correct. Nope, I'm wrong. So I'm going to put that in don't know. So when I go back to study again, it's going to bring up all the stuff that I didn't know, or the ones that I wasn't sure of. Again, what's the normal hematocrit? I think it could be 12 to 15. I'm wrong. It's 40 to 50%. So I'm going to drop that down to don't know. Okay, so it lets you go through all of those different lab values. So if that's what your topic is for that day, or one of the topics that you're going to be studying, you can come here and do these flashcards. And again, you're only going to do them for about an hour a day. Go in and review the cards, and it tells you how many is there. It's 91 cards in this deck. So you can go in and review those 91 cards, however long that takes, and then stop. You're done for the day. You would come back the next day and you can do it again, or you could review your concept map. So as you're answering these flashcard questions, you can have your concept map beside you to see if the information that's on your concept map coincide with what's on these flashcards. Okay. You can go back to the beginning and then scroll down to see what you're going to be doing in class, okay? Are we doing a health assessment? Do we want to do just the NCLEX review? So I can click on NCLEX review 139 cards under this, and it gives you some questions. Stay with client for the first blank minutes of a blood transfusion. I think the answer is 15. Okay, so I'm going to cut within 3 to 4 hours, right? Or 2 to 4 hours. I'm going to click and see if my answer is correct. And it is. All right. What type of blood transfusion reaction manifests with proctitis, respiratory stress, itching, and flushing? I'm not sure what the answer to that is. So I can click to flip, and it's going to let me know that it's an allergic reaction. Okay. And I can put that with don't know. What type of blood transfusion manifests in flank pain, chest pain, fever, chills, tachycardia, and tachypnea? That could be an anaphylactic reaction if the first one was an allergic, right? I'm going to click, and it's saying hemolytic. So I'm going to say that I didn't know. So again, you want to go through these cards. So it's saying erythropoietin is produced in what? Is it the red blood cells? Is it white blood cells? I'm not sure. I'm going to click and flip, and it's saying it's in the kidneys. So you're getting all of that information that you need. And then everything that you don't know, you can always come back and review. You can hit retry, and it's going to put those ones right back into your card deck so you can keep answering those. And also, as you can see, it's timed at the bottom. So you know that we've been doing this for 1 minute and 43 seconds. The goal is to only do it for an hour. So once this gets to 60 minutes, you're going to stop, and then you're going to go on to something else, or you're going to be done for the day. Okay. So again, these flashcards are a great tool to help with studying. And then you can go down the list and pick whatever you want to study, that 𝐸 study planner. This website, again, is an excellent tool. The information is already developed for you. It's already there. You just have to go in and utilize it. All right. The other piece that I wanted to show you guys is another website that puts this information in a template format for you. Okay. So if you're someone that likes to have your information in template format, the other website is already going to have that information together for you. Again, you just need to access it.